Hello, welcome to my presentation on benzylpenicillin sodium. My student number is U3284225. What is benzylpenicillin sodium? Benzylpenicillin sodium can be classified to be in the penicillin drug class. It can also be commonly known as penicillin G. Benzylpenicillin sodium is an antibiotic indicated for the treatments of infections such as meningitis, inflammation surrounding tissues in the spinal cord, syphilis, which is an STI, pneumonia, an infection within the lungs, and septicemia in children, which is blood poisoning. Benzylpenicillin sodium is compounded in a powder which is used for intravenous or intramuscular injections. Pharmacokinetics of benzylpenicillin sodium. Absorption. Benzylpenicillin sodium is given through injections, as it lacks absorption when taken orally. It is primarily absorbed at the site of injection, but also depends on dosage, patient condition, and concentration. Benzylpenicillin sodium is absorbed through muscle, tissue, and the bloodstream. The bioavailability of this drug is 100% when given through injection. Distribution. Distributed via the bloodstream and water content within the body, it penetrates tissues and fluids such as the cerebral spinal fluid, allowing it to be a fast-acting drug. Peak distribution can occur in bile and the urinary tract, aiding in UTIs. Elimination. Benzylpenicillin sodium is primarily secreted by the kidneys, specifically through the glomerulus filtration within the renal tubules. If renal function is normal, 70% of the dose of benzylpenicillin sodium is eliminated within the first 6 hours, 10% by glomerular filtration, and the remainder by tubular secretion. Benzylpenicillin sodium's half-life is between 30 minutes to an hour in healthy patients. Metabolism. 16 to 30% of an intramuscular dose is metabolized to pentacilloid acid, an inactive metabolite. Metabolized to pentacilloid acid, which an inactive metabolite, small percentage of benzylpenicillin is hydroxylated into active metabolites. Pharmacodynamics. Penicillin G is a beta-lactam antibiotic used for bacterial infections by gram-positive organisms. This drug works by inhibiting the bacterial cell wall synthesis and binds to penicillin-binding proteins. These proteins are crucial for the cell wall to achieve synthesis. By binding to these proteins, it inhibits the third and last stage of cell wall synthesis, causing it to weaken and causing lysis, which is the deconstructivity of the cell wall. After this process, it inevitably causes bactericidal. Efficacy of benzylpenicillin sodium. It is highly effective against gram-positive bacteria, but has mild to low efficacy against gram-negative bacteria. Physiological effects. Benzylpenicillin sodium, as many other drugs, have side effects. This drug has a variety. Most common ones, as stated by the AMH, are diarrhea, vomiting, nausea, and inflammation or pain at the point of injection. Some rare side effects that can be caused is black tongue, bleeding, neurotoxicity, and hyperkalemia, which is high sodium levels in the blood. Some immunological effects are dermatitis, fever, anaphylactic shock due to allergies, and angioedema, swelling under the skin. This can be life-threatening. Ethical and legal considerations. Benzylpenicillin sodium is a Schedule IV medication, meaning it is only available with a legal prescription order. Benzylpenicillin sodium can be prescribed by a doctor, nurse practitioner, midwife, dentist, and optometrist. Benzylpenicillin sodium is encountering a shortage within Australia due to a delay in manufacture and delivery from an overseas manufacture facility. With any drug, consent is required before administration. Counseling considerations for benzylpenicillin sodium. Continually observe patient's renal status. Avoid quick administration of large doses, as this may result in seizures. Triple check patient's allergies, specifically to penicillin. Observe site of injection for any abnormalities. And observe signs of side effects. Benzylpenicillin can be given to pregnant women. Side effects include rash, feeling faint, vaginal thrush, abdominal cramps, fever, and diarrhea. Test your knowledge on benzylpenicillin sodium. Thank you so much for listening.